CEO at AIDS United. Welcome to AIDS United and our series of conversations highlighting the importance of maintaining our federal government's financial commitment for addressing the HIV epidemic in the United States. We simply cannot achieve our goals for the HIV epidemic without federal funding, and the Ryan White program is central to our efforts. So today we're highlighting the Ryan White program because it's America's safety net for funding for HIV treatment, care, and support. And it does so in all 50 states and territories. And we'll feature today Vivint Health as a leading provider of Ryan White services. Now, I've worked with the Ryan White program since its inception. It has funded services for people living with HIV for now 32 years. It's funded by $2.9 billion in appropriations from Congress, and it's always enjoyed bipartisan support. But the Republican-controlled House of Representatives is seeking to cut funding to the Ryan White program for fiscal year 2024 and cut funding to other HIV programs as well. So we think it's important for everyone, and especially for members of Congress, to hear the success stories and to understand the importance of sustaining the Ryan White program as a critical component of our shared pursuit of ending the HIV epidemic in the United States. And today we're excited to have Vivint Health as a leading provider of HIV services to have our conversation with us today. And we're delighted to welcome its CEO, Dr. Brandon Hill, who joins me for this conversation. Vivint Health is one of the nation's largest providers of HIV services, operating from multiple states across the Midwest. And Dr. Hill assumed the role of CEO just a few months ago, having served before that as Vivint's Executive Vice President and Chief Operating Officer. And before that, he was Executive Director for Education, Research, and Advocacy at Howard Brown Health in Chicago. And before that, he was President and CEO of Planned Parenthood of the Great Plains. He's an expert on LGBTQ health, on sexual and reproductive health, and of course, an expert on HIV services. He has a PhD with a concentration in behavioral science and psychology. And believe it or not, Brandon, I think this is the first time you and I have actually had a conversation together. So welcome to AIDS United, Dr. Hill.
Thank you. Thank you very much. Happy to be joining you.
Dr. Hill, the Ryan White program is so important. It serves nearly half of the 1.2 million people living with HIV in the United States. It has over 560,000 clients being served across the U.S. and territories. And today, 92% of all those 560,000 clients are virally suppressed because of the work that the Ryan White program does for them. But also, nearly 60% of the Ryan White clients in America live at or below the poverty line. So they depend on services like those provided by Vivint Health. So tell us, Dr. Hill, what does Vivint Health do as a provider of Ryan White services?
Sure, thank you. Vivint Health is a multi-state network of HIV prevention and care centers across the country. We're focused primarily on providing a team-based integrated care approach, serving nearly 20,000 people living with HIV or at increased risk for HIV exposure. Like you said, we're in 5 states from Colorado, Illinois, Missouri, Texas, and Wisconsin. And our model is a team-based approach that is both clinical and social support for our patients and clients. It's a space where medicine, pharmacy, behavioral health, dental is incorporated and part of the care that's food and nutrition, housing, and case management. Optimally, we're looking to make sure that our patients and clients thrive.
20,000 clients across all those states. Dr. Hill, tell us who those clients are. Can you break it down a little bit for us? And what kind of services do you provide, for example, to people like me who are gay men of color?
Sure. So we serve a pretty diverse range of people across the country. But when we look at the Ryan White program, that programming allows us to serve uninsured and underinsured individuals particularly those that are facing any kind of socioeconomic challenge. When we look even further, we're helping communities who are most impacted by HIV in any given state that we're in. And that normally means LGBTQ individuals or Black, Hispanic, Latinx, or other people of color, those communities. That's who we're primarily serving. These are some of the folks who are the most marginalized. When we look at things like housing instability, food insecurity, we're really, through the Ryan White program, aiming to help re-engage or engage for the first time those who are really existing at the margins.
And there are so many who are existing at the margins who are living with and vulnerable to HIV. One of the groups that we are hearing so much about in the news, of course, are the attacks against the transgender community. Are transgendered services part of Ryan White services that Vibin Health provides?
So we definitely provide Ryan White programming and services to people who identify as trans, non-binary, and gender diverse. So that's definitely part of the host of core services that we aim to provide. The full program, and we have from Ryan White Part A, B, C, all different funding sources, as a whole just allows us to reach those who actually need access to HIV care and treatment.
Mm. At Age United, we're expanding our emphasis on Black women. Black women are often neglected in terms of their vulnerability to HIV and that they're living with HIV. Are Black women part of the client cohort at Vibin Health?
Definitely. While not nearly as impacted as we see on a global stage, where women are really, the core population, we definitely have Black and Latino women that are part of our Ryan White funded programs, but definitely part of the diverse patient and client population that we serve.
How do you go about finding clients or getting clients to come to your services? Because, as you said, they are so marginalized. What brings them to Vibin Health?
Yeah, that's a great question. Folks come to us many different ways. A lot of it is through our engagement with the community, as well as being part of the care community in all of the cities that we're in. That helps other providers link. Our model of care, where we're using a more socio-ecological model, really has been identified as working for folks who might have multiple or complex needs. Just today, we were talking about some of our patients. Our patients and clients sometimes have a number of needs, and getting them healthy takes many steps. When we look at our dental program, when that works with our medical program, some people living with HIV have foregone dental care for 25 years. That's not going to be repaired in 1 or 2 visits. It's also not going to be repaired with a small amount of resources. So we need a lot of resources to get these marginalized individuals healthy and stable. And that's a long-term journey and requires a lot of support.
Mm-hmm. Dental care. I have a dental appointment next week. So tell me, dental care is covered by the Ryan White program?
So we have certain, some funding programs, depending on which city we're in, will be covered through Ryan White. We receive Ryan White directly through HRSA, others through local health departments. So, dental can be part of this, behavioral health, our whole suite. There's almost nothing that Vibin isn't offering that in some part isn't funded by Ryan White. It's every part of it is part of the work that we're doing.
Dr. Hill, walk us through what it's like for a new client to arrive at a Ryan White clinic like at Vibin Health. What steps do they go through to become a client, and what steps do they go through to make sure that they want to come back to receive services for perhaps the rest of their life?
Right. Our patient journey is pretty unique. When we get someone who's been linked to us, maybe someone who's test positive out through community outreach, we do our best to get them in either same day or next day or as quickly as possible for a new diagnosis. That's a lot of information to receive for an individual new diagnosis. And we're And because of the generosity and the support of funded programs like this, we're able to spend the necessary time to make sure that an individual understands their diagnosis. We can also talk them through what other resources they might need. Again, we are looking at housing, if housing's an issue, if there's some behavioral health needs, or at least putting that out there. The integration means that both the medical provider is in touch with and is colleagues with our food and nutrition department, so our food pantry. So if that individual does share that they're experiencing some food instability, we're able to say, okay, we'll finish up this appointment. We'll let you talk to the behavioral health expert and provider that you wanted to meet with. And before you leave today, we'll make sure that you leave with some food, so food package, so that you can take with you. And that is the unique thing of Vivint Health, is that it's integrated. So these are not just, yes, we have a food bank on your way out, or we offer behavioral health. The team is working around the individual. The individual's part of that care team. And in that moment, we define what is needed now for them to start their journey on living a healthy life while living with HIV.
I was able to tour one of your facilities in St. Louis, and I saw the beautiful food pantry that you have at your clinic there. And I wondered, do Ryan White funds support those kind of services like food and nutrition?
Yeah, so yes, so we can use different aspects of the Ryan White funding to support food and nutrition. We have found that food as medicine, is really essential for the population, who benefits from the Ryan White program. Mm-hmm. This is really this full socio-ecological model where we know that in order to engage and live a healthy life with HIV, in order to be virally suppressed to where you're not able to transmit or pass HIV, we need to address the social and the ecological needs, which is food and housing. And those are two areas where, the Ryan White program definitely helps us achieve viral suppression by actually using those tools as medicine as well.
But getting to food and nutrition and housing, that's not something that your doctors and nurses do. Who does that work for you?
Sure. So we work and rely a lot on, and this is where Ryan White funding is really core, both case managers and then folks who are housing specialists or food pantry specialists. And those individuals work in concert with our medical and clinical professionals to identify folks who may benefit from those services. And again, it's that integrated model where your doctor will know that you visited the food pantry, the pharmacy will know, and if there's any way that they can help continue to support, living healthy with HIV, they're going to come together and do that. Very rarely can a patient walk by and try to skip out on the dental appointment. We will remind them that, hey, no offense to my dentist, we have wonderful dentists, but we're always going to say, hey, our doctor noticed that you have a dental appointment next week. Don't forget to be back and make that appointment.
That shows a real caring model, a real patient-centered model. Brandon, I just had my doctor's appointment because I've been living with HIV for 4 decades now, and I just had my doctor appointment last week. And I'm wondering, how do we make sure that our clinicians, especially in Ryan White programs, are operating from the best current medical knowledge to treat your patients? Are they?
Yeah, so like I said, our model of medical care is different because we actually, because of funding like the Ryan White program, are not in the same kind of constraint to where we're having a high volume clinic where you're trying to move people as quickly as possible. Our folks do come to us, and again, because we are able to reach what I would consider hard to reach populations with multiple health needs. There may be diabetes needs, there may be cardiovascular needs, and we're able to treat all of those simultaneously in order to get someone to be healthy. We have some of the leading providers working for us. We have a lot of university affiliations where a lot of our providers and clinicians are also leading experts in the research world as well as the training world. And almost everyone has been specialized in HIV care and has been doing this for a number of years.
That gives us as patients great confidence. But I understand that nearly 50% of all Ryan White clients are now age 50 or older. And I certainly am concerned about living with HIV and aging. Is there a special approach that you take for people who are aging with HIV, who are over age 50? Are there special things that you particularly look for or provide your clients with?
Yeah, the oldest patient we have is 88 years old. So we know that we have people living long, healthy lives with HIV. That said, our approach and what really some of the benefits of the Ryan White program is that we're able to meet people's needs where they are in their own life journey. Not everyone needs housing assistance for the 30 years they may be living with HIV, but because they're here and because we've built trust and care with those individuals with their HIV care, when they do need those other services, we're able to provide them, and we're right there behind them to support them through whatever life might hand them. As we look at our aging population, the changes that we're looking at are around making sure that we're monitoring food insecurity and housing stability, because those do come up as challenges. The other is looking at other behavioral health screenings to look at social isolation, depression, and making sure that our community is cared for and engaged. We also work with a lot of partners, community partners in almost every city or state that we're in, to make sure that we connect folks with other resources, not just us, that provide group support, peer-to-peer community groups. And that's becoming more and more necessary for our aging population living with HIV.
I still meet people who are newly diagnosed, who are operating from deep stigma and shame. And then I'm meeting people who are long-term survivors who are operating from isolation and ageism and depression.
Mhm.
Are mental health services covered by the Ryan White program?
Yeah, so behavioral health and our mental health services definitely are part of the benefits of the Ryan White program, both indirectly and directly. And we are able to provide those services. Often we have behavioral health providers that are on call and available, particularly for new diagnoses, because that's one of the things we want to make sure that we offer that support as well.
And of course, a core component of the Ryan White program are the medications that are given to patients. How does it work that patients actually get medications and get refills and get new medications if they're available, like injectables?
Yeah, one of the things about being a AIDS service organization is that we are very honed in on HIV care and prevention, and we're often some of the first sites to try and make available any new innovation in drugs like injectable. And we have, we've been an early adopter and have continued to work on how we make the injectables more and more available. But in general, we're fortunate that we also have our own pharmacies integrated into our model of care. And those pharmacies, ensure that a provider can walk a patient right over to the pharmacy, and that, someone who's well trained and experienced in HIV pharmacy, as well as all other, general pharmacy, can support and offer that continuity of care. And that's the new connection they make. And that is their pharmacy, their pharmacist. And often they're coming back and able to engage. And when they come back for pharmacy, we're again able to say, hey, we noticed, would you like anything from food pantry? We noticed that, and connect as needed. It's this constant connection, this network of support that really um, helps make individuals healthy and stable and able to live their best lives. Like I said, there's all different types of individuals who come through our doors. Some have, more complex needs than others, or might be facing other challenges. Others might just need a medical visit and the pharmacy. Our programs and our funders are what makes it possible. But it does take a lot of effort, to keep folks engaged who might be facing a lot of social structural barriers outside of our walls.
Dr. Hill, I know that you're a people person, but also the head of a major corporation. When you think of success stories from a client-centered perspective, what success stories would you like to share? What success stories would you like a Congress member to hear that Vibant Health has made a difference for in someone's life?
Yeah, I think, one of them is that when we think of our unstably housed, almost every city that we're in, there are individuals that are unstably housed, often just trying to survive. And those individuals who are living with HIV, who's trying to survive,
Mhm.
it is a huge hurdle to get to healthy.
Mhm.
When we're able to connect with that individual through our outreach, get them to one of our health centers, that is the start of a multi-year journey
Mhm.
to a healthy life. We have individuals, um, you know, unstably housed who come in. We're able to treat HIV, but the first thing they actually need is something to eat, and we're able to provide that right in the lobby. Is something to eat. Then come in, and then we talk about not being in care and how to get them re-engaged. We
Mhm.
talk about behavioral health or any substance use that they might want to address. It is a multi-staged, long, worthwhile investment. It's the humanity of healthcare. We're not just providing access. That person might take 6 months, 18 months, 3 years to where they're living a healthy life, where they're virally suppressed, where they're employed, where they're able to have housing, um, and that work needs to be done. And it is the ASOs and it is the Ryan White funded health centers that are taking up that humanity and taking up that work. It's not, there's no magic bullet to engaging and maintaining people in care. It's compassion and support, which is time, energy, and resources, money to do this. But this is, at the core of having a humane and compassionate society.
Well, let's talk about money as we come to the end of our time together. You were the COO at Vibant Health. What would you not be able to do if you did not have Ryan White funding?
Well, well, we wouldn't be able to do a lot without Ryan White funding, to be honest. Um, you know, this to not have Ryan White funding for an organization like ours would be devastating. We would be looking at, you'd have to scale back, sunset programs, you'd have to shift hours of operation, which would inherently limit access. Um, this is an investment in individuals who are part of our society. This is an investment in marginalized individuals, in the health of people in our country. We would dramatically shift. And I really, have no doubt that if we were to lose funding at Vivint Health, or if others lost funding who are part of Ryan White, um, we would be moving backwards in the HIV epidemic, the fight and ending the HIV epidemic. And ultimately, it would lead to people foregoing care or more HIV infections in our country and among those who are most vulnerable.
And what would happen to those 20,000 clients that you're currently serving if the Ryan White program had reduced funding or funding eliminated?
Yeah, their lives would unfortunately be directly impacted and would change. And I think we'd lose the footing through particularly the viral suppression rates that we've been able to achieve, because we would now be part of the institution that's marginalizing them versus the part that's been supporting them and getting them through to live their best life.
Well, that's the dire circumstance that we're hoping to avoid. But before we close, I'd like to ask you this, Dr. Hill, Brandon, what are you most proud of with regard to the work that you've done for the HIV community at Vivint Health? What are you proud of?
I love walking through our lobby every day. I see the look of patients and the smiles on their face. We hear such gratitude. And it's, I mean, not that we're not deserving, but it is, I'm most proud that when we walk into any clinic, we see folks who are living their best life, who are able to be healthy, who have overcome many challenges. And just the fact that we're a little part of it, is something that all of us at Vivint are very proud of.
Thank you so much. That's really quite inspiring. And I know it works to help provide a real foundation for the kind of successes that the Ryan White program makes possible in communities all across the country. And we can't thank you enough for the work that you do at Vivint Health. So, Dr. Hill, thank you so much. And thank you to all the staff and your team at Vivint Health. You are doing great work. And people like me who are living with HIV and people vulnerable to HIV are so grateful. The Ryan White program would not be a success if it were not for the successful work that Vivint Health and your colleagues across the country all do. So the Ryan White program remains a critical component of our arsenal at the federal level to support organizations at the grassroots level that are doing the work needed to end the HIV epidemic. But the Ryan White program is at risk. If passed, the Republican spending bill would slash $767 million in federal funding for HIV programs, including parts of the Ryan White program. Those programs are indispensable in our efforts to end the HIV epidemic. Each of them needs more funding, not less. Each of them needs more funding, not less. And your members of Congress need to hear from you. Visit your Policy Action Center at ageunited.org to send an email today to your Congress member. It's very simple, but can have a big impact. So thank you for taking a few minutes of your time to hear about these important issues and to hear how you can make a difference by reaching out to your Congress member to let them know how important the Ryan White program is and how important it is that they continue to support federal funding for ending the HIV epidemic. And thank you for joining us today to hear about the important role of the Ryan White program and the great success at Vivint Health. Thank you all for being with us. Thank you for what you're doing in your community. Goodbye, and thank you for all that you're doing to help end the HIV epidemic. Age United is with you, and we will be until this epidemic is over.